Alrighty, I'm back. So as I was saying in the last video, um, I'm gonna share with you now um what my lower body looked like and the damage and harm that has been done. And this is real. This is real and this is serious and it's causing me a lot of health problems. And my biggest fear now is thinking that one day I might wake up and not be able to walk, that I'm going to be paralyzed. Um, is I don't, I, so much has been done to my body to, doctors don't even want to go in to do any type of corrective surgery. You know what I'm saying? They're scared and they say it's too risky. Is really, to have any type of corrective surgery really puts me at risk. So mainly I basically just have to deal with the pain as it comes. And like I said, I'm not blaming anyone for this, what I'm saying, because this is something that I had made up in my mind to do, and this is the result of it for me, what I'm saying. It's not like that for everyone. It's, some transgender girls' body are just perfect, what I'm saying. Some are not experienced problems, and you have some girls that may be going through some at some type of degree or another, what I'm saying. You never know. But I'm mainly speaking of me and what has happened to me and the things that I'm going through. So what I'm gonna do is I'm gonna try to back up a little bit, and hopefully you can get a chance to view and see what has been done to my body. And please take a good look and know that this is real and this is serious. And I'm now, like I say, I'm reaching out to my gay community, to transgender girls and people that are considering to become transgender women. I want you to know the potential dangers of illegal silicone injection, black market silicone, underground silicone, however you may determine, dealing with people who are not licensed physicians, such as myself, who are practicing medicine without a license, and the damage and harm that they can do to you, to your body. You're to blame as well. Let's what I'm saying, we're to blame for the things that I don't blame the girls who were pumping me. I blame myself because, what I'm saying, I had a choice and a decision to make, and I made that choice. So now I got to deal with it. But this is what my body looked like. I'm trying to get tie my shirt up in a knot, because I don't know how much of your body you can expose on these videos, because I don't want them to say that this is like a nudity content. So, but as you can see, I'm sitting in my box, but this is what I look like. Let me pull this down. But I'm gonna share. This is my, as you can see. Let me pull it down a little. You can see the discoloration. You can see how black it has turned. I'm gonna turn around a little bit and let you look at that side a little. I had 2 abscesses to come up, and I had to have surgery, and I had to go up on the anesthesia. So that little mark that you're looking at is where I had surgery, where they had to cut me and let it drain. But anyway, as you can see, it's like a line right here, and now what it is where my seal is beginning to drop, and it's causing my body to like sink in. So it's like I have a big dent in this part of my body, and the thing is about it is really, really, really hard. All of this, my butt area, my hip area, it's like wood. See, I don't know if you can hear that or not, but it's like knocking on wood. You can see as I hit it that it's not moving the way that it should move. You know, like down in this area. But other than that, I want you to pay attention to the darkness area. And if I put it down a little bit more, so you can see. Just look at the dark area. Now I'm going to let you have a look at the other side, which is the left side. Hopefully you'll be able to see that. And this side is a little bit worse than that side over there. You can see the blackness, the darkness, mainly the same thing, the sinking in of the body, and like the hardness of it. Take a good look. This is, and all of this is from the silicone injection. As you can tell, the lighting in my room is not that good. I'm sorry about that. But I'm sure that you can notice the different skin tone, the different skin color. You have the darkness right here, and the lightness of this is my actual skin complexion. And as you can see, as I stated earlier, the discoloration, this is where I've lost circulation in a lot of part of my body where there's really poor circulation. I'm going to slowly turn around and let you grasp this, get a good look. And it's really just, okay. It's really just ugly to me. Let me see if I can get pics of my leg and let you see how all of this is somewhat swollen, but you can also see the darkness in the leg. I don't know if you can see that real good, but take a good look at this leg. It's really awful. Let me walk off some, hopefully. Let me see if I can turn so that you all can get a good look. I want you to see, you can see the lightness and the darkness of my leg where I lost the circulation. You can see a little lightness. It's like a little line, like a little streak. I hope that you all can see it. Let me see. And now recently, let me put this up. I recently just started experiencing problems in this leg, and as you can see, it's doing the same thing. I'm losing circulation in this part of my body, and it's beginning to show. See, as you can see, it's beginning to show. See, if you take a look, you notice how dark I'm here in this area, and then once you get up in this area, this is more of my actual skin complexion in my lower body. So this is what my lower body look like. This is those are the injuries received. So as I was stating, you know, now I'm experiencing problems, and the problem is, like I say, is poor circulation. Still is pressing up against a main artery in my body, and it's causing my blood to not flow properly as it should flow. You know, poor circulation. So this is a problem that I have to deal with the rest of my life. And I hurt a lot. I'm in a lot of pain. That's why nowadays I take it more easy. You know, as I say, I retired from the dread life. I retired from doing shows. You know, I given up trying to wear female clothes, you know, trying to walk around in high heels, and I used to love walking around in high heels, but I no longer do that. You mainly catch me in a pair of comfortable flip-flops, you know, some comfortable bedroom shoes, something to help keep the swelling away. Anything to keep the swelling off my body and away from my body, I do that. But I just wanted to share what my body looked like with you all, so you all can see the damage that silicone can do to your body. And I feel that there may be some girls out there that's really might be going through worse than what I'm going through. So to all of the girls who are, as I say, to each of you who are considering having these injections done, once again, please do your homework. Understand what you're getting yourself into. Know that there are potential dangers. It is a 50-50 chance. 50-50 chance of something going wrong. Anything could go wrong. You never know. And maybe not. Maybe not. You never can tell. It's just a chance. But if you're gonna do it, if you want to do it, go about it the right way. I advise anyone, please, you just go about it the right way, because I don't want anyone out there to go through or experience what I'm experiencing. It's basically trying to put a stop to this. It's trying to put warnings out. People, I mean, you hear about it, but you really don't see it. And I used to be so ashamed to show my body. And I'm still ashamed to show my body, because like I say, I didn't look like this. My body didn't look like this. I used to have a nice body even before I even started injecting myself. You know what I'm saying? I had a nice body. I wasn't hella fine, you know, as they would say. I wasn't hella fine or anything like that. But I had a very nice toned body. But over the years, with age comes all this. But mainly over the years, since I've been injected with silicone, and the last time that I was injected with silicone was in 2002. So I began to, after 2002, that's when all of my problems began. After I received my last injection, that's when all of my problems began for me. But I'm gonna end right here, and I do plan to put out more videos soon. I got the my next video, we're gonna go into me going to court and what happened in court, and I'm gonna give you my experience in the court. Then I plan to put out videos and talk about my time that I spent in prison, and some of the things that I done in prison. And these things are very touching to me. Very touching to me. It's very emotional for me. But I pray and ask God to give me the strength and to lead and guide me in making these videos and doing these videos, because it's very, very, very important to me to know that I reached out and I put it out on the table. I wasn't afraid to put it out there on the table, and that I'm reached. If I can just reach 1, 2, 3, 4, 5 people and save them for making the same mistakes that I made, to actually make them really think about what they're getting ready to do or what they want to do, and go about it a different way, then I feel that my job is complete. My job is done. And I am now, like I say, I'm a God-fearing person, and I just ask the Holy Spirit to lead and guide me each and every day. I ask God to come in and take control of my life, and to make me a better person than what I used to be and what I am. And He's doing it. He's working on me, and He's working in me. And I hope that you can see that. So, as of right now, have a blessed day. Thank you for watching the video, if you're watching. And if you are watching, please post, share, comment, good or bad. I'm looking for all viewpoints. So, please share the videos with other people. Help put these videos out, and let's save some lives in our community. Let's just save lives anywhere and everywhere. Have a blessed Saturday, and I love you all. Thank you so much.